Thank you for watching this episode of Pathologies Indicating Massage Therapy. In this segment, we will explore dysfunction that manifests in the adrenal glands of the endocrine system, commonly referred to as Cushing's syndrome. Cushing's syndrome presents itself through various symptoms, including weight gain, especially in the midsection, rounded face and extra fat on the upper back and above the collarbones, high blood sugar, high blood pressure, osteoporosis, muscle loss and weakness, thin, fragile skin, purple and red stretch marks, depression and fatigue, excess facial hair in women.
So what is Cushing syndrome? Cushing syndrome can be also referred to as hypercortisolism and consists of the physical and mental changes that result from having high levels of cortisol in the blood over a long period of time. To better understand Cushing syndrome, we must first understand cortisol. Cortisol is a steroid hormone produced by the adrenal glands as a part of the
Cortisol, when life will stress me, you'll protect me. Hormone. When life will stress me, you'll protect me. Hormone. Can't handle stress if you're not there. You reduce inflammation when I fall down the stairs. Should I fight or go along? Give me a sign. Cortisol. When life will stress me, you'll protect me. Hormone. Cortisol. When life will stress me, you'll protect me. Hormone. ACTH, challenging the dreams to produce the cortisol. Without you, what can I do? You're one of my hormones, I understand. I know we're one, my body and I. We have to go on. Cortisol.
So now that you know a little bit more about cortisol, let's talk about what happens when you have too much cortisol. This is defined as Cushing's syndrome.
Good morning and welcome to the Pathologies Indicated for Massage Therapy. I have here Dr. Sarah Boyle. She's a leading researcher in the field of the human stress response. She's here to discuss Cushing syndrome today and how it affects the human body. Please, without further ado, Dr. Sarah Boyle.
Thanks so much, Trevor, for the introduction. So Cushing syndrome is simply heightened levels of cortisol in the blood over a long period of time. For a while, it's not Cushing syndrome. It becomes chronic. It starts to negatively impact the body, and then you have Cushing syndrome.
Understood. What if you have symptoms and signs you might find with someone suffering from Cushing syndrome?
That's a good question as well. So one of the main symptoms is going to be weight gain, and it is rather specific weight gain to the mid-body and not the extremities. So you have this appearance of a larger midsection with thin extremities, as well as a rounded face and possibly neck, as well as a humped sort of visual on the back with fat accumulation as well. You're also going to experience hypertension, hypoglycemia, muscle loss, weak bones, depression, fatigue. So at some point it does become very concerning for someone who's developing Cushing syndrome.
And what might a treatment implant include for someone suffering from Cushing syndrome?
So Cushing syndrome is going to be treated based upon the cause. It's most often caused by, the body being stressed out for whatever reason, or the mind being stressed out for whatever reason. You can't reach that homeostasis, right? So you're going to be looking to eradicate stress from your life. You're going to be looking to calm the body, and you're going to be looking to calm the mind.
Now, would it be safe to say that massage therapy is a safe indication for someone suffering from Cushing syndrome?
I would say absolutely. And just to differentiate between Cushing's syndrome and Cushing's disease, if you have Cushing's disease, you definitely do not need to be getting a massage, because Cushing's disease is often caused by a tumor in the endocrine system. Whereas Cushing's syndrome is simply elevated cortisol, it's stress. And so massage is going to be a fabulous intervention for that, to find that homeostasis, to promote the parasympathetic response in the body. It's perfect.
Wonderful. Thank you very much for your time, Dr. Boyle. And that concludes this segment of Pathologies Indicated for Massage Therapy. We'll see you next time.
Bye.